they've got low back pain, whatever. You work on their hips, you work on their glutes. Piriformis is a huge one to work on. So let me show you something real quick. Flip over. So piriformis. When you do piriformis, try to get the passive contraction. So try to set it up that the muscle is as short and relaxed as possible. What does the piriformis do? External rotation of the hip. I'm going to externally rotate her. Okay? I just shortened the piriformis, but I slackened the piriformis. Now I can come in. Piriformis is going to attach on the sacrum, so always imagine your anatomy. I see her sacrum. When I see, you know those old overlays? Those old overlays in encyclopedias? That's what I see. I see deep tissues, and I peel a few layers back, and I'm like, where am I now? Always imagine where you are in the tissue. So I'm going to start right on ASIS. I'm going to come down a little bit, lateral to the sacrum. I'm going to hook my fingers in, again, making minimal contact to skin. I'm going to make most of my contact as broad as I can to be comfortable, but I'm not groping. So I'm going to pull down and away. This is piriformis, the start to glute medius. Get down a little lower, you're getting into piriformis, pulling down and away. So I'm hooking, using my top hand for pressure, bottom hand for contact. So if I push through my bottom hand or my contact hand, that's where you get more problems because people are going to feel that more. If you push through your top hand and leave your bottom hand soft, it's not as painful. So the piriformis is a pear-shaped muscle that does this. Remember, sciatic nerve normally will come out in between, on top, or behind the piriformis. If the piriformis looks like this, where does it attach? Basically, okay, I'm not trying to dissect anatomy here, but it's basically going to hook. If I hook her greater trochanter and strip around the greater trochanter now, I'm going to affect the attachment area of the piriformis. Okay, so I hook around the greater trochanter, kind of ream that out a little bit. If I find areas that are worse, I can sit into them a little bit. If I want to stretch that now, what do I stretch? I stretch by doing the opposite of its action. Take her into internal rotation so I can hook underneath, relax. If you do it, it tightens it back up. So I just torque the leg, or I can use her leg as a lever, brace, internally, externally rotate the thigh by using her leg. Use caution if you have somebody with knee pain. Okay? If you're using their leg as a lever, or if you have somebody that is Gumby. Okay? If you have somebody that's hypermobile, they're very, very flexible, their knee is moving more than their leg. Okay? So if I brace here on the femur, to try to get that stretch with her leg, and all that's moving is her knee, because it's sloppy in there, not doing her any good, I'm not doing me any good. Okay? So there's a brief aside for piriformis.